I'm Michael Banyas. I'm one of the program managers for the NIH's Small Business Innovation Research Program, and I'm just going to talk about market opportunities specifically for digital health. I gave a very similar presentation a few weeks ago for Bunny Ellerin's group for DHNY. So I don't know if anyone saw that, but Bunny, has the recording if you want a more in-depth view of the program, what my institute does, but also my colleagues from Aging and Heart, Lung, and Blood. So first, just to let you know, what the NIH's mission is, because this is a very different program that is open to not just people on the academic career track, but also people that don't have PhDs, that they could have bachelor's degrees. That our goal is with the SBIR program is to help fund and it is to help NIH accelerate discoveries from bench to bedside. So taking those products and either commercializing the research or creating products to help support research for things like clinical trials or data collection or delivery of diseases. I mean, not delivery of diseases, delivery to cure diseases. Yes, we're not, sorry, it's the end of the day for me. So just the NIH SBIR program in general. So we have $1.4 billion a year that we push out into the market in the form of $300,000 to $2 million grants, depending on the phases. And I'll go into the phases in a little while. Now, depending on the institute, that $1.4 million is kind of broken up depending on the budget size. So NCI, NIHLBI, NIA, that's aging. Those are some of the $1 billion clubs. They've got like $200 million. My institute, which only has like $500 million, I know, boo-hoo. I've only got like a $20 million budget, but I'm gonna give you an example of why it's so, we have such an important leadership position in helping ensure health equity, but also helping companies target opportunities for them to reach customer bases and make them focus on how to deliver to that market. So just a little bit about the SBIR program, again, and STTR program. SBIR is just solely for small businesses. STTR, you need a academic partner. Now, does that mean if you're working with an academic entity, you can't apply for SBIR? No, you can just use them as a subcontractor. And, it's more, I'm not gonna lie to you, it's more advantageous to apply to SBIR because there's about, $1.3 billion compared to like $100 million for STTR. So there's a big budget disparity. But, if anyone's got any questions about what program is the best fit, please reach out to me. So as I mentioned, there's a couple different phases. First, phase one, that's proof of concept. I like to say, do small research questions. Small research questions, not like your overall big research question, but small research questions like how, for clinical trials, how would this patient consent form work, with bilingual populations, or how to commercialize the delivery of diabetes care to a very small, to rural health populations. So phase one is proof of concept, and it's also could be used to enter different markets if you've got an existing technology. And I'll go into those markets in a little while. Phase two is commercialization. That is the larger research question. You're going to go to market in 2 years. That's about a $2 million grant right now. Phase one's about $300,000. And then you can apply for fast track, which is phase 1 and 2 combined, and that's dependent on the institute on whether or not they're actually participating in the program. And then you've got direct phase 2, which is you can skip phase 1, and if you've got a technology that you think you can go to market in 2 years, apply for that direct phase 2. But this is all a game and applying. So that's why calling up your program officer is very important, and we're here to provide that customer service to help you reach that potential. Now, just a little bit about how you're going to be reviewed, because this is going to go into what I'm going to talk about with markets. So you're going to get a 3-person panel is going to review your application. And for those of you who want to know what the process is like, the gentleman over there in the corner from Ponds, he went from getting a score of a 41 to an excellent score of, under 20. So he's going through the process, but a lot of it is he worked with us on how to actually focus his application for success and also knowing on how he's going to be reviewed. So the first thing is you're going to be reviewed on staffing. For example, if you're doing a dietary app and you're a computer scientist and an auto mechanic and that's on your team, you're probably going to need someone that's actually focusing on dietary science to actually, show that the work in the project could be carried out. If you're focusing on, oncology, you're probably going to want someone with experience in cancer care. The other thing is significance. Why does this matter? Why does this matter? And once again, when you're looking at different markets, specifically health disparities markets, you're going to want to show why it matters to this market population, this patient population. And what's the innovation? Why is this different from the standard? Are you delivering what's typically delivered through telehealth? Are you doing it digitally? Are you doing it through more in-person care, home-based care? What is different than, what is the innovation there? And the next is the approach and environment. The approach and environment, they really do need to go hand in hand. For example, your approach is how you're going to implement the project with your team to combat this significant population, this significant problem with your innovation. And if you're doing your approach, you need to, and you want to focus on a rural population, you're not going to use an urban population in New York as your testing bed for your phases. So just kind of some program goals and how when you're applying to the NIH and you're like, well, where do I fit into the institutes? The most important thing to do is to look at our strategic plans. The institutes do a very good job of updating our strategic plans. And just some examples of why that's also important is at the Minority Health and Health Disparities Institute, we're disease agnostic. So we don't focus on cancer, we don't focus on heart, lung, and blood diseases. We kind of focus on everything. That includes those diseases. But we also aren't focused on drugs, but devices, services, digital health, and other means to close health equity gaps. If there's a health inequity there, that is a market situation. That means that there is an imperfect situation in the market in which customers are not getting a product, and that is an opportunity for you as a small business. And the other thing too is when you're looking at these market opportunities and you're looking at your NIH Institute, find out what the IC director who signed off on that, the Institute Center director who signed off on that strategic plan, what they're going to be willing to cut a check for. Like my Institute director, he wants to fund concepts that promote research to understand and improve the health of racial, ethnic, minority populations. Advance scientific understanding that causes health disparities, develop and test interventions to reduce health disparities, and create and improve scientific methods, measures, and tools that support health disparities research. You write a concept like that, when my IC director goes through who to fund, that's going to speak very, very powerfully to him. Because just remember, in your application, in your abstract, that's going to be your only time to talk to the guy who cuts the checks. So just some health disparity terms and recognized populations, but these are also populations that the NIH sees as suffered from health inequities, but these are also where applying for a phase 1 is absolutely great, especially if you're trying to figure out how to enter different markets. And the way I would apply to the NIH SBIR is look for what you need the cash for or a potential check 9 months from now, not what you need right now. I can't help you right now, but do some strategic planning and look at your business plan and be like, 9 months from now, we want to take our existing technology and we want to, we want to enter African American populations, or we want to enter sexual and gender minorities, which is LGBTQ, or we have something for people with disabilities, but we also want to do, you can apply for multiple phase 1s. We want to do people for disabilities that are from Latino populations or people from disabilities that are in rural areas. You can apply for as many phase 1s as you want, but use that to enter these markets, because these are patients, and when you do your market analysis research, that aren't getting health services, and they're suffering from what we call research considerations, and these are the barriers to health equity. So when you're looking at why aren't they getting healthcare, or why aren't they getting this health research, look to see if there's a disparity caused by a physical impediment. Knowledge, that's health literacy. inability to, like, I'm a pretty educated guy, and some of the patient consent stuff I read, I can't even figure out. So, or medical journals. Like, I look at it, I'm like, you might as well be speaking French to me. And I grew up in academic medicine, and yes, so that would be like a knowledge barrier. Imagine if you're a working class person with a high school education or no formal education, and you're trying to make health decisions based on something that has been cited, that's something that's been published in like the Journal of Oncology or something. You're just not gonna understand it. Infrastructure. Is there a barrier towards not getting care or being able to conduct a clinical trial? Is it an economic barrier, or is it a cultural barrier? Cultural competency is a very powerful way, especially when you're looking at your phase ones, but taking that existing product and saying, something's working in New York City for, say, Caucasian white populations, but why aren't Latino populations taking it up? Well, a cultural competency is maybe it needs to be bilingual. So the way to really look at how to apply like these phase ones, or when you're looking at your business plan, is if a process takes A, B, C, D, and it equals health delivery, how do you eliminate or amend a step to deliver your ends? Or as Mr. Shapiro said yesterday, to reduce friction. How are you gonna eliminate B or C, or merge B and C together in a culturally competent way, or increase infrastructure so that you're delivering innovative care to this patient population that is your customer base? So just some examples of safety net providers, just because this is definitely some of the stuff that we're definitely looking at funding. And yes, I know there's some typos in the slide, because I did it for Ainsley at the last minute. The last minute in about 20 asks. But like, when you're thinking about implementing your digital health technology or your service, look at, for example, how remote patient monitoring could work for Medicare and Medicaid providers, or homeless shelters, or community care clinics. These are places that get an awful lot of federal funding, and oftentimes they're having to buy products off the shelf that aren't really good for their care environment. So, one of the things we're looking to fund with NIH is how to actually carry out this care, like these products that are actually tailored to these different safety net providers that have revenue that companies can get because they're getting so many federal grants. Federally qualified health centers are another fact. HRSA funded programs like rural hospitals, Healthy Start, those are great places to help create products to achieve health equity, use precision medicine, strengthen the workforce, especially in areas where they have a tough time retaining and training workforce to deal with these complicated patient populations. So just some opportunities on when you can apply for us, and we can talk further about market opportunities. And this is what I do all day. I'm on the phone all day long, helping people do their business, look at their business aims, figuring out how to slice, dice, focus, so that they can apply the program. Every year, January, April, and September, there is the general application period for NIH, and you can apply to up to 2 institutes. There's also Innovations for Healthy Living, which is health disparities focus for services in digital health. And a number of other NIH institutes are also signed on to that. Definitely read the full RFA to see who's participating. And that is June and then December 10th. And then women's health, and I'm going over to one of our investment partners after this, and they keep on reminding me I've been saying this for 2 months. Women's health, I thought it was going to come out this week, but it should be out next week, and that's going to be women's health and research focused on health disparities populations. And that's one of the great things about using these funding opportunities is they show, even though they're NIH research priorities, they show what opportunities are out there that we're looking to fund that we think aren't being covered. For example, with women, lots of talk about endometriosis and menopause. Not a lot of talk when I go to these finance conferences about clinical trials, immune disorders, teen girls. So those are going to be some opportunities that we have integrated into this women's health and research and health disparities RFA. And I will send it out through the HITLAB when it's finally published. I love working for government, but sometimes like waiting for them to actually push out something that you're like, why did it happen 3 weeks ago? Can be a little frustrating, but this is the life I chose to lead. So if anyone has any questions, please let me know. I hope I didn't put you to sleep. But once again, we're here to help you figure out not, my institute in particular, like these aren't poor people that aren't getting healthcare. They're potential customers that need your products. It's just, there's just a barrier there towards getting them services. Any questions? My former federal colleague. Yeah, how are you?
That's awesome. Thank you. Given our recent election, and given that these are all
Well, you know better. I can't ask the answer.
I
She's a former executive in federal service. Okay, go on. I'm sorry.
is it possible that if policy directions shift a little bit, like how insulated are these programs, especially if we're looking at applying?
That's actually a really good question. Okay, so I take it back. So
Pivot.
the only way that these programs, so these are congressionally mandated programs. So they are all dependent on each institute's what is called extramural budget. So Congress, each NIH institute has what's called an appropriations line item. Cancer has theirs, neurology has theirs, and if Congress gives us $500 million, like for example, last time Congress upped our budget by like 100 million and like slashed neurologies. The program budgets are a mandatory 3% of the extramural budget. So if the extramural budget goes up, my budget goes up. If the extramural budget goes down, my budget goes down. So they're all mandatory spending programs based on the appropriation. I probably should have explained that, but I was trying to zip through my slides and not sound like a bureaucrat. But that's actually a very important question. So the program is not going anywhere. It was actually just reauthorized in Congress. And yeah, so, but $1.4 billion is a lot of money to be putting into the market every year. And you're gonna get feedback regardless. And sometimes it's a good way, because we kick the tires on these concepts based on science, not by profit opportunities. It's a good opportunity to see where your holes are in your business concept. But, you could take it to maybe potential investors and be like, hey, I got this score from NIH. This is where they saw us, and we may or may not get funding, but we have a good opportunity here that might be attractive to you. And this is what an outside body of scientific experts has said.